In this video, I'm going to explain to you why exercises alone is not enough to get you pain-free. You might think I'm crazy because I'm a physical therapist and that's my bread and butter, but that's the reality. I'm going to tell you, aside from exercises, what else do you need to get rid of your pain? First is manual therapy. As physical therapists, this is something that we provide in the clinic. We also do soft tissue work or joint mobilization to targeted areas to alleviate the tightness or improve mobility. Second is proper movement and posture. Moving properly and maintaining good posture can reduce the strain on your body, thereby reducing your pain. Third is nutrition. Having a diet rich in anti-inflammatory foods such as fruits, veggies, and omega-3s can help reduce the inflammation in the body, thereby reducing your pain. Connected to number 3 is number 4, weight management. The more weight you have, the more unnecessary stress you put in your body, and those unnecessary stresses on the body will wear it out sooner than normal. If you're finding this helpful, support us by subscribing to our channel. Number 5 is quality sleep. Sleep is when your body heals the most. If you don't have good sleep, your body will not be able to heal efficiently, and it will not be able to relieve the inflammation that occurs on a daily basis. Another very important part that is often missed by physical therapists is stress management. Stress increases the inflammation in the body. Now, I know that is not the primary focus of our practice, but reminding patients to be mindful of their stress level and also recommending exercises such as deep breathing can go a long way in managing their stress. Ergonomics and adjusting our environment is also very important. Adjusting our environment, especially a workstation, can help prevent repetitive strain. Pain education is also very important. Knowing what causes your pain can help you avoid it, and knowing what relieves your pain can help you do that more. If everything else fails or the condition is too severe, then further medical intervention may be necessary. This can include pain medication, injections, or even surgery. But we like to leave that as the last resort. For other tips to help you relieve your pain, watch the next video.